going to talk to you about combination therapy and what's going on at Regeneron. It's important to look at why do we need combination therapy. Anti-VEGF therapy has really revolutionized our treatment of AMD and DME. But if you look back to the wet AMD trials of View 1, View 2, only about 1/3 of patients were three-line gainers, and only approximately 70% of patients were dry on OCT. And in DME, if you use Protocol T for the first year, about 42% of patients gained 3 lines, and about 2/3 of the patients had a central foveal thickness of less than 250 microns. So there is room that we can do better. And how do we do better? Well, we need new targets, and there are 2 targets that Regeneron has focused on. One is platelet-derived growth factor, or PDGFR, and the other being angiopoietin-2. And as you know, PDGF recruits parasites, and the parasites act in a way that they protect the blood vessel, and they make them less sensitive to anti-VEGF therapy. So if you could strip the parasites, such as Fovista has done, you may be able to make the blood vessels go away and make them much more sensitive to anti-VEGF therapy. And angiopoietin-2, Ang2 also plays a major role in the vessel development and sprouting and regression of the new blood vessels. And I'll show you how both of them have fared in phase 1 trials. So ranibizumab is a co-formulated with co-formulated anti-PDGF and anti-VEGF. It's a single 50 microliter intravitreal injection, and it's a human recombinant antibody that binds to human platelet growth factor receptor B. Now, in this study, when you used aflibercept alone, or if you used the anti-PDGF alone, you had a very excellent reduction in the mural stripping and regression of newly formed blood vessels. However, if you do both of them together, the effect was intensified. There was a phase 1 study that was done where 4 different doses of the anti-PDGF were used. The 0.5, 0.3, 1 milligram, and 3 milligrams combined with 2 milligrams of aflibercept. And it was a dose-escalating trial. There were 4 patients in each cohort, and the patients received monotherapy if needed at week 8. There were no dose-limiting toxicities. There was no intraocular inflammation and no serious adverse events. The 1 patient did develop an RPE tear, resulting in a loss of greater than 20 letters. It was not considered related to study drug. Capella's the phase 2 study design is 2 different doses of the anti-PDGFR combined with aflibercept, 2 milligrams, compared to the gold standard aflibercept, 2 milligrams given monthly. The endpoint will be the readout at best corrected vision at week 12, and the patients will receive the dose. There are 500 patients enrolled in this study. Anti-Ang2 and anti-VEGF therapy in neovascular AMD and DME, it may be able to be modulated by another drug called the neovascular, which is combined. And we know that angiopoietin Ty2 is a tyrosine kinase receptor, and there's an Ang1 and Ang2. Ang1 is expressed in normal cells, and it is meant to maintain vascular stability. Ang2 is found only in pathologic conditions and very little in normal conditions. If you use, again, looking at this, the bar on the extreme left-hand side is postnatal day 4. The other 4 bars are postnatal 6. The first bar that you see is the control, then aflibercept, and then the Ang2, and then the combination. As you can see, the combination was much stronger. Here we can see if you combine those, there seems to be a much longer lasting effect, lasting out to 14 weeks. The study designed the phase 1, there were 5 groups. that ranged from 0.5 all the way up to 6 milligrams, and then a 6 milligram dose with no aflibercept. There were no dose-limiting toxicities, no serious adverse events in combination. There was one SAE. The combination therapy seems to prolong the effect of the aflibercept alone. We now have the Onyx and the Ruby. There are 350 patients that are being in the Onyx and 300 in the Ruby. Ruby is the AMD and Onyx is the DME. 2 different doses combined with aflibercept against aflibercept. So in summary, there seems to be synergistic targets. We will have a report of the anti-PDGF in the second half of this year, and it seems that these are well tolerated with no serious adverse events. Thank you.